Hello and welcome to our video instruction on how to use the Contact Detach Infusion set. Please note that this guide is not a substitute for reading the instructions for use, which comes with the product. Please refer to those instructions for a complete list of warnings and precautions. When using the product for the first time, do so in the presence of a healthcare professional. The Contact Detach is a steel needle infusion set inserted at a 90-degree angle. Here you can see the parts of the infusion set: disconnect cover, tubing, connector, circular protective cap, connector needle, needle guard, retaining wings, 90-degree steel needle, adhesive tape, backing paper, coupling housing. Before you begin, check the sterile paper on the blister package. Do not use if the paper has been broken. Wash your hands before inserting the infusion set and choose an insertion site as recommended by your healthcare provider. Do not use the area right next to your previous infusion site. Clean the area for insertion with a disinfectant as directed by your healthcare provider. Be sure the area is air-dried before inserting the infusion set. Open the blister pack and take out the content. Start by removing the paper and the protective cap from the tubing. Connect the coupling housing to the tubing. Be sure you have the connector needle right side up to connect to the site, otherwise it will not connect properly. You will hear a click when it connects. Connect the infusion set to the pump. Before attaching the set to your body, fill the infusion set until insulin dispenses from the tip. When filling the infusion set tubing, hold the infusion set with the needle pointing down to ensure that insulin does not get in contact with the adhesive backing paper. Pull up gently to remove the adhesive backing paper. Carefully remove the needle guard by gently twisting and then pulling it up, taking care not to touch the needle itself. Pinch the skin at the insertion site with one hand and grasp the retaining wings of the infusion set with the other hand. Insert the infusion set straight into the skin fold. Press down on the back of the adhesive tape to secure the set to your skin. Gently massage the adhesive tape onto the skin. Remove the backing paper from the coupling housing. Attach the coupling housing to your skin somewhere that will allow for easy disconnection. Ensure that the short tail of tubing between the needle and coupling housing is not too tight. Because it doesn't use a separate introducer needle, the Contact Detach Infusion set does not require a cannula fill. The Contact Detach Infusion set allows you to temporarily disconnect your pump without having to change the infusion set. Hold the adhesive tape in place by placing a finger just in front of the coupling housing and gently squeeze the sides of the connector needle. Pull the connector needle straight out from the coupling housing. If needed, cover the connector needle with a circular protective cap and insert the disconnect cover into the coupling housing until you hear a click. Remove the circular protective cap. Ensure the flow by filling the tubing until insulin dispenses from the needle. When filling the tubing, hold the connector needle pointing down. Remove the cover from the coupling housing. Place a finger in front of the coupling housing and push the connector needle straight in until you hear a click. Now you are ready to restart your insulin delivery. We hope you found this video helpful. For further information about the infusion sets, please contact your local infusion set supplier or Convatec Infusion Care.